so much. Thank you so much, and wishing all a very happy International Women's Day. It's my privilege and honor to be here to contribute my knowledge to all of you. Right. So can I have my presentation, please? Can we make it a slideshow? Yeah, great. Thank you. Right. Okay. Can I think I can manage it. It's okay. Yeah, it's fine. Right. So, what I thought of discussing with all of you for the next 15 minutes or so is to discuss about some period issues, what we called as menstruation, to discuss if it has any problems, to discuss about the discharge, which we all experience at some point, and to discuss about a condition which is called as PCOS, polycystic ovaries. And I think we read about it a lot, but let's kind of discuss about it and understand what it is. So let's kind of talk about, I have added a lot of pictures in my presentation so that you can see and understand also. So what is a normal menstrual period? It's a monthly period, it's a monthly bleeding, which every young girl and woman gets every 28 days. This generally lasts for 5 days. It can have spotting before the start of the period and also when it's finishing. So that is very normal. So if you see this diagram, so why the menstruation happens? This is a uterus, right? So there are changes. A female body has a uterus. There are a lot of changes happen over 1 month which cause this bleeding. There can be hormonal changes, there can be changes in the structure of the uterus, and hence every month a girl or a woman who is not pregnant get periods. So if you look at this chart again, if you see the circle, there are 28 days, right? So first to 7 days are generally the time when a woman bleeds. From 8 to 19 days, it's what we called as a period when a woman starts developing an egg, right? And this is the time when the chances of getting pregnant are the most. From day 20 to day 28, this is the time when the uterus is stabilizing, the hormones are becoming less, and this is the time when the pregnancy cannot happen, but the body is preparing to get a menstrual period next time. So this is a very important chart which can help you understand. Right? So why do we want to focus on menstrual health? Because WHO says, the World Health Organization, that it is an important aspect of a woman's body. It's very important that a female should understand about this. Female knows how to handle it, and like Mr. Abhishek in the beginning, in the previous talk, he said, a lot of girls do not understand about the cycle because they cannot communicate to their parents and they cannot communicate and understand about it. So it's important we discuss about it, we talk about it, and we are aware about it. Sorry, I'm not being able to go next. Yeah, okay. Just 1 second. Yeah. So that's why the government also kind of stressed on focusing on this menstrual day and celebrating the menstrual day, right? So it's a menstrual hygiene day, what it is called as, because it's important that we keep a hygiene on those 5 days when we are bleeding, because blood can be a source of infection. So it's very important that we maintain hygiene, and that's why the government stressed that we should all celebrate 28th May as the Menstrual Hygiene Day. Now this is very interesting. Why 28th May? Because a menstrual cycle is for 28 days. It lasts for 5 days. So to understand and to remember it, 28th May is the World Menstrual Hygiene Day. And that's why we should not hesitate to talk about it. Let's talk about it, because it's a natural process of any female body. Any woman who is young in a reproductive age group from 13 to 44 years will have a menstruation, and it's very normal. Now, how can we maintain, like I said, very important to maintain hygiene, right? So it's very important that, the pads which we wear, we change it frequently, we wash our hands, we dispose of our pads very hygienically, we put them in a proper dedicated dustbins. So there are four main things which have to be looked after. If you can see on those diagrams, four main things which are very important from the aspect of menstrual hygiene. And this is the reason why it's important to talk about menstrual hygiene. It should not feel as a burden. It should not be, getting a period should not be a burden. A woman or a girl should be able to do her normal daily routine when she's having a period. She should be able to go to her work. She should not feel, hesitant to use pads, to dispose of the pads. There should be no hidden things when she is menstruating. Should not be any hesitation. So we talk about the normal menstrual cycle, but some girls can have problems where the cycles are less than 21 days. They come in 21 days, or they don't come even after 35 to 40 days. So this is what we called as irregular menstrual cycle. There can be a condition when the bleeding can be heavy. Generally it lasts for 5 days, it can last for 7 days, 10 days. So this is not normal. So if you are experiencing these things, you should go and speak to either your parents, your healthcare provider, whoever is close by, and discuss with them. Other thing is the painful periods. Now it is very normal to get pain with periods for 1 or 2 days when the periods start. It's very normal. But if the pain stays despite the end of the menstrual cycle, let's say after 5 or 7 days, then you need to go and be checked yourself, right? So not for, I would say, first or second day pain, because everybody gets it. I think I just need help. Okay, so this is all about the menstrual cycle. So the next point which I wanted to discuss was about the discharge, right? So what we called as a vaginal discharge. It's very normal for every female to get a discharge. For the first 14 days after the menstrual cycle ends, the discharge can be a little watery, thin, but for the next 14 days before the start of the next menstrual cycle, it can be sticky, and generally it's white. Now, why do we, and for this reason, we don't need to contact anybody because everybody gets it. But we should be concerned when it becomes little smelly, when it becomes it changes its colors. From white, it becomes yellow, red, which I will discuss in the next slide, or you have a itching down below. So all these things should lead you to discuss and talk about it. Yeah, so this is a kind of I wanted to again bring the diagram of a uterus. So you can see this is the uterus, the triangle thing which you can see is the uterus, and the underneath the white thing is the vagina, which has the discharge. So discharge, there is a lot of myth that the discharge comes from the kidneys, the discharge comes from the urine, but no, it comes from the vagina. It's the secretions. These are normally the secretions. Next slide, please. Yeah. So what is a healthy vaginal discharge? Like I said, everybody gets it. So we should not panic and get concerned. But yes, there are conditions when it is abnormal vaginal discharge. And like I said in the beginning, it can be a change of color, it can be change of smell, it can be itching, which we call as abnormal vaginal discharge. Now coming to the colors, white is normal, but if you get a yellow discharge, a pink discharge, a red discharge, all these are the conditions which you can have. But I would not go in detail because you should consult a doctor if you see a change in color. You should not treat yourself. There are some medications which are available over the counter for infections like yeast, fungal infection. There are creams. There are pessaries to keep in the vagina, but it's always good to get yourself checked first and then get these medications. So this is again a table which I wanted to bring in about the abnormal vaginal discharge. It says if it is a yellow discharge, it can be an infection. If it is a red discharge, it can be an inflammation or redness on the cervix, which is the mouth of the uterus. Again, the reiteration is to get yourself checked. Now coming to the last aspect, which is the PCOS. I'm sure a lot of you may have heard about it, you may have read about it. So PCOS stands for